Well, TRT World's health correspondent Nicola Hill joins us now from London. And Nicola, we've been talking about these variants for a while now, but exactly what does this mean for the pandemic?
Well, I think really, as some of the variants you mentioned there, Rachel, the worry is that basically the virus is going to mutate. It's not going to be effective against either the immunity people might have built up from having had COVID-19 or from being vaccinated against it. And that's why really there's a race to try and vaccinate and protect as many people as possible before the virus mutates again. It's worth saying that this is something that all viruses do. They mutate to exist, to carry on living, but they don't really want to keep killing their hosts, which is what COVID-19 can be doing here. So some of the variants then die out, some become stronger. It's like you said there with the UK variant, because it binds so tightly to the spike protein, that's why it becomes so much more transmissible and it's being spread more easily. Whether or not it's more dangerous, initially they thought it was, then they thought it wasn't. This is still being investigated. As is the genomic sequencing of the virus as it does mutate. You've got lots of developed countries who are able to do this, able to spot these new variants, but you've got other countries not as sophisticated and not able to do this, so we genuinely don't know whether other variants are in circulation at the moment. But what we do know is the need, as I say, to ensure that people are vaccinated and to make sure that they are protected. And you've got a lot of countries who are saying they're closing borders. They want to prevent these variants from coming into the country. Unfortunately, you can't necessarily do that because we've got travel, we've got the more transmissible variants, but we also have the fact the virus is mutating. So you will have similar mutations that are here in the UK now appearing in other parts of the world. It's not that the virus has spread, it's just it's mutated in the same way.
Yeah, it certainly seems with all the things we've learned over the last year that it is impossible to stop the spread of this virus. I'm wondering, though, because a lot of people were hopeful that with the vaccines it would mean the end of the pandemic, but are there concerns that the vaccines will not be able to treat these variants of the virus?
Yeah, very much so, actually. We do know that, for example, the Oxford-astrazeneca vaccine is effective against the UK variant. But there was a very small study done in South Africa in young people that showed it wasn't working there. Although I was speaking to Professor Paul Hunter this morning, who's Professor of Medicine at the University of East Anglia, and he actually wondered why this trial had been done in younger people when we know that they're not necessarily as likely to pick up COVID-19, and also it was a very small study. He said what's important is that a lot of the vaccines are preventing severe COVID, they're preventing hospitalisations and they're preventing death, and that's what's so important. And that's why the need to vaccinate as many people as possible is so urgent. We know that the Janssen vaccine, that's the one-shot vaccine that's just coming into Europe now, the trials of that one were done later in the year when some of these new variants were around. So we know that that does seem to work to a certain extent against the South African variant. We're also learning about a variant coming in India. They're saying it's a double mutation. Now, Professor Hunton says there's actually lots and lots of mutations, but what you have to worry about is something called escape mutations, and these are the ones that actually escape immune response. In other words, if you've had a prior infection or you've been vaccinated, perhaps it's not going to give you the right protection. You might still get COVID-19, but hopefully you won't get the severe disease and you won't need to be hospitalised. So we have got the pharmaceutical companies already looking at their second generation of vaccines. I believe Moderna are waiting on the regulators to start a trial of a modified version of their vaccine to see if it's going to be protective against the South African variant. And both Pfizer and Oxford-astrazeneca are in talks to see what they can do to modify their vaccine. And as we see more vaccines being developed, like GSK are working on another one, hopefully they will then work against new variants. But it is a race to develop a new vaccine to work against the new variants before the virus mutates again.
All right, Nicola Hill in London. Nicola, thank you.